In the health center tonight, it is another effect of the pandemic across the country, a rise in opioid addiction and drug-related deaths, and it's hitting especially hard in West Virginia. West Virginia University is in the middle of a groundbreaking study now aimed at solving the problem. And tonight, NewsNation correspondent Tom Negovan takes you inside the operating room for a dramatic surgical procedure, a last-ditch effort to save an addict's life.
Garrett Fox's world is about to change, and just in time.
That's what I thought, you know.
Yes, those are holes that have been drilled into his skull, and yes, he is conscious, as he will be throughout the operation. In fact, here he's responding to neurosurgeons adjusting the electrodes wired to his brain, helping them calibrate his treatment for an addiction that's almost killed him more than once.
My family was, sorry, I'm pretty nervous right now.
We chatted about it before his surgery.
It was just a hell on earth, man.
Garrett's story starts like so many stories of addiction do. He's a fine young man from a supportive, upper-middle-class suburban family. When he was 14, he had his wisdom teeth pulled, was prescribed oxycodone for the pain, and a young guy who felt the angst almost all teenagers do suddenly felt good, normal, worry-free, but he needed more, and then even more, until one day Garrett Fox was shooting heroin, cut and laced with all kinds of things, including deadly fentanyl. He's overdosed over and over, come right to the brink of death, which is what makes him perfect for this.
This is for patients who have failed every previous treatment, are severe and disabled at end stage, and they really don't have any other options.
Dr. Ali Rezai is a brain surgeon, the only one in America who's done this before, just once. It worked, connecting a pacemaker to a human brain. It's been used for Parkinson's, epilepsy, OCD, and now addiction, but only the most extreme cases.
And the goal of the pacemaker here is to see if we can reduce the cravings and reduce the electrical imbalance in that part of the brain and calm that part of the brain down so that we can normalize it better so people can be more in charge of their cravings and less anxiety and less of a drive to seek drugs. Because if you've had more than 10 overdoses like Garrett has, God forbid one of those overdoses, if there's somebody not next to him to revive him, bring him back, he may not return.
That's right, more than 10 overdoses. It's actually been 12, with Narcan administered nearly every time to keep Garrett from dying. He's convinced his next OD will be his last.
The past time in January, I was Narcan 4 times from that one overdose because the first dose didn't work, the second dose didn't work, the third one didn't work, and they were about to just call the EMT and tell them that I had died. And they gave that fourth one, and I finally came out of it. And that's just a ridiculous number to be at death's door that many times and still come out the other side. So it's having that many chances, to get your life together. And now it's I have this opportunity to make it finally.
And so far, he's making it, thanks to groundbreaking medicine that's not just treating addiction, but also removing some of the stigma around it. See, the CDC tells us every single day, 130 Americans die of a drug overdose, that 20 million adults in this country suffer from some sort of substance abuse problem, likely a lot more than that. And while they can't all get surgery, thanks to cutting-edge science, more of them can get help. In New York, Tom Negovan, NewsNation.